The Alaska Native Tribal Health Consortium has a vision that Alaska Native people are the healthiest people in the world. The consortium provides many health services for our people across Alaska, in our homes, communities, and at the Alaska Native Medical Center. Our 2,500 staff come to work for ANTHC because they know that they're going to make a positive difference in the lives of our people. Every single day, ANTHC works to improve the health of our people. A consistent focus at ANTHC is to increase access to care on the ANMC campus, and this year we invested an immense amount of time, energy, and resources to make that a possibility for our people, adding 30,000 square feet of clinical space. ANMC added a new outpatient surgery center with 4 operating rooms for day surgeries, which helped us increase the number of surgeries we can provide. We also expanded our cardiology and neurosurgery clinics and completed construction of additional labor and delivery rooms. This work continues into next year as we renovate campus space for internal medicine, infusion, oncology, podiatry, pulmonology, and orthopedics, to improve the experience and quality of care at ANMC. We expanded our telehealth program, increasing access to care in our specialty clinics, which helped us add more than 20,000 additional specialty care appointments. This year, we also welcomed more than 1,600 new babies at ANMC. ANMC obtained certification as a comprehensive pediatric emergency center, the highest certification possible. We are the first and only hospital in Alaska with this certification, which benefits the entire Alaska tribal health system. Our hard work is leading to results. Our progress can be credited to our board of directors' vision and the efforts of more than 2,500 employees, more than 40% of whom are Alaska Native or American Indian.
I started working at the YK Hospital in the summer of 1972. And I started seeing kids and young adults that were jaundiced with hepatitis, and then I saw a couple of children that had liver cancer, and I thought, wow, something's really wrong here. So I surveyed people for hepatitis B and found extremely high rates in some of the villages. We vaccinated 53,000 Alaska Natives, and incredibly now there is no Alaska Native person under the age of 30 who has chronic hepatitis B, which is just amazing because there's no other population in the world where all children are free of this infection. So then along came hepatitis C, and so it was really important to get cured. So now we have these wonderful new drugs, once a day pill, 95% cure rate, very mild side effects, but the cost is astronomical. It's $98,000 for 12 weeks. We decided to ask ANTHC to get us a machine called FibroScan that gives you a reading that correlates with how much scarring is in the liver. And in more than 50% of the patients, we can get a result that will be accepted by the insurance company. As a provider, you don't get a chance to cure people very often. And I really appreciate the support from ANTHC and really getting behind this.
Kivalina is a beautiful, wild place. The people are strong and resilient. They have to haul their water, and so they are very, very good at conserving water.
They have to be able to use that water from October to May. Ultimately, good health begins in the home, I think. The project is an in-home sanitation system, and including rain catchment, a tank, and you get clean quality water, and once that gray water tank is full, will be discharged. I think the most exciting part was to see the homeowners' reaction of when they got to turn on the faucets.
They tell me about how, their 3-year-old son won't stop playing with the faucet with the water because they have running water for the very first time.
A unique thing, though, what ANTHC did was they funded a portion of the construction of it. Having ANTHC taking a chance, that's cool.
So LEO stands for Local Environmental Observer, and we refer to it as the LEO Network. And it's really, it's a network of people who share observations about our changing environment. If you're in the hospital and the condition of your patient changes, we have monitors and doctors and staff. But with a community, it's not that easy. And that's why we developed LEO, and people post observations about changes in seasonality, changes in weather, new wildlife species, changes as far as the condition of traditional foods. And then there's also these big events like storm events, erosion, flooding. We find that a lot of the observations are grounded in local and traditional knowledge. What we're really trying to do is to help the tribal health system to understand the range of impacts that are occurring and then what to do about it.
Community health workers are human beings. They're people who need to take care of themselves just like anybody. And I think we expect so much of community health workers that sometimes we don't realize that they also need support.
Health aides, in my experience, they're amazing people, that they are really motivated to be there for their people, their families, their relatives. So in order to provide that care for a whole career, we need to be able to provide them with tools to stay healthy themselves.
So the Healthy Healers curriculum is one that we have designed ideally for community health workers.
To teach people self-sufficiency, self-resiliency.
There's nothing that speaks more loudly to well-being than somebody who is living it themselves.
Having providers out there in the villages that can address these issues on a daily basis is really the way that we're going to get ahead of the game. The better we can support the hard work they're doing and the amazing jobs they're doing out there, the better it is for everyone. And the closer we're going to get to being the healthiest people in the world.
Successful efforts in 2015 have set the stage for additional improvements in the coming years. We look forward to bringing these advancements to the Consortium and improving access to the services we provide in partnership with our people.